A 5-year forward view plan has identified prevention and integration as key factors that will help sustain the longevity of the NHS. Marianne Ochota went to find out how Swan Housing Group is working with local authorities and CCGs to meet this goal.
In North East Essex, a rapid response team has been deployed. Their job, to help keep a vulnerable resident out of hospital by providing vital support in their own home.
Hello, Kim. Hello, Jackie.
Graham and Kim are part of the home care and support service developed by Swan Housing Group in partnership with their care provider, Vivo Support. It provides home care, falls prevention help and home adaptations in one integrated package.
And if you've got your prescriptions from the chemist, they're all up to date?
The service aims to reduce preventable hospital admissions as well as help residents return home quickly and safely after being discharged. Over 2,000 people have been helped so far, and a social return on investment analysis shows a £6 return for every £1 invested, with significant savings for local council and clinical commissioning groups.
Working with the CCGs, they are certainly within North East Essex. We have been fortunate that they're very open to new ideas of working, and within other meetings that I've been to in the sector, it seems to be that everybody's moving to that approach where they don't go out and tender a service. They say what they would like to deliver and then people come up with their own ideas of delivering it. And I think that's why the CCG has embraced Swan so much, is that we are very good at designing, creating services. We have new ideas and that is what they like about us.
Housing and health partners have long shared goals to help improve lives in local communities. Working together means even more people can be reached.
We have a social imperative. Our organisations are there not just to provide bricks and mortar, but there to really help the communities that we serve flourish and grow. And one way we can do that very positively is help them live healthy lifestyles and access the appropriate services as best they can.
Integrating home adaptation and care services and then being able to deploy those services quickly means that Swan can support residents as well as relieve pressure on the NHS. But some of their most innovative projects are about preventative action from the outset. Dovecot House Foyer is a supported housing scheme for young parents and their children. Residents stay for 1 to 2 years, developing skills to live independently and build a strong foundation for their family's healthy future.
We were fortunate enough to gain funding from the Foyer Federation to run a year's programme of Healthy Conversations, which is now totally embedded in the way that we work. So Healthy Conversations is about the overall well-being of the young person and their child. It is about more than just a diet or stopping smoking, it's about their entire well-being. So whatever makes them feel well and makes them flourish and thrive, that's what the Healthy Conversations is about.
When I've done Healthy Conversations, we put down college and what I'm going to do in the future, and eating right, getting exercise to keep me happy and not always down. It's good with the support, they're really good. It'll help me in the future. Everything I've learnt here will be with me forever now.
Along with that formal support, there's all the informal support, all of the communal activities, the parenting programmes, the cooking classes, the weaning sessions. We have the health visitor come in, a midwife come in. We have a whole range of services brought here so that when those young people move on to independent living, they've already got those community links, and so they are in a position to just carry that on when they move out of here.
Experienced at partnership working and with established positive relationships with residents, housing organisations like Swan are in a unique position to help bring innovative healthcare into people's homes and lives.
We don't see particular clients as hard to reach, we see organisations as hard to reach. So for us, it's very, very important to get into the heart of the communities in order to get a healthy conversation going, which is true and honest for that individual. So at Swan, we've got the contacts, the resources and the expertise to deliver services on the ground which really make a difference in people's lives.